lumbar joint play.
Well, I'm going to show you the flexion. Part of the reason is that some people do this. It's a way to see if they open up. Oh, I know what I'm going to get is a spine here so I can show you where I'm palpating. On this one, I'm going to be flexing from the bottom up. So I'm going to take her legs and I'm going to monitor, again, at the junction. And I want to put my fingers there and feel that open up. And then sometimes I lay my fingers kind of like that, and then so I feel that one open. If I keep flexing her knees up, now I feel that one open. Then I feel that one open. Then I reset my fingers, and I see. So I'm going to be feeling in these interspaces, because when people flex, they should open up, right? But I'm working from the bottom up, so I'm going to come here. Because if I try to go here, I have to go by all this first. If you're not subtle, you may run right by it. You may go, oh, I need to, and then you'll go, well, I don't feel anything. Well, it's because you ran right by it. Make sure you kind of creep on it. You can do it with one or two legs. Legs are heavy, and I'm getting older, so I always almost do it with one leg. But you can do it too. So the first thing I'm going to do is get her in a kind of a neutral position, and I'm going to start where I think the junction is. I'm going to put a finger there, maybe another one up from it. And then I'm going to, if it's a two-leg deal, we relax, I'm going to just get her right in the crux of my hip here. And there I feel that moving. So if you're doing it right, I'm going to plug this in just to emphasize the point. Trip over it and die, but if you're short, tables don't agree with you, at least try to get to one of these that move so that you can get the right setup. If you do this right, it's fairly low grade. It's not too tough. I just need to bring her up. Because you'll be moving from your hips, and you really won't be working too hard. So let's see, this might work a little bit better. Oh yeah, there we go. Now, that one's moving, that one's moving, that one's moving, and there. So I can feel those opening up. At this point, that will mean little or nothing to you because you're so hot. But in the real world, if someone was really stiff and he felt like, well, that one didn't open up as well as the stuff below it, or the stuff that would come after it. So maybe they're a little restricted in flexion. Flexion usually is not the biggest issue, so that's why I don't do it as much. The reason you need to know this skill, though, is for the mobs and for the treatment later. Because what this will help you do later is find a level. So you'll go, oh, I'm down here, this is the base, this is S1, so there's that L5, that's moving, all right, 5, 4, I think that's when they're stiff, and this is now where I will do some kind of work. Okay, so it's nice later to help us find the level. So now, if you were restricted in forward bend, I could come down and just kind of get a sense of how well does this move? Is there any spot here that doesn't open up as well? Now, what will people do? It'll be, it's so heavy. I want the spine here. I want you here. I want this is it. It'll work. If it's hard work, you're not positioned right. Okay? And again, I could just do one leg. And this is what I usually do. So I can get that somewhere rested on me and keep her fairly level. What I don't want is to put her in a rotation or jam her back into extension. So I want to try to level that out. So that's why I say it's good to get a table where you feel as if you can move that and feel that open up. That's good. Everything's moving. Da-da. Okay? So that's how we would do the flexion joint play if we wanted to see does it move well the joints. Side flexion, got a couple ways we can do that. Since she's side lying, I'll drop down to 2 and 3. And then we'll show the prone version. The nice one about that is if you've mastered this one, side bend is going to be pretty darn close to that. Because this time I'm going to take her legs, get her anchored in. All right. Yeah, I want your spine a little straight. It's not too bad. She's getting cozy on me. So I'm going to take it up and I'm going to go, all right, that's the levels moving. How does it tolerate side bend? How does it tolerate side bend? All right. So I go up the spine, creeping from the bottom. Side bend it there. Side bend it there. Side bend it there. Side bend it there. All right, and so you should feel it move as you come up. So my fingers are basically sitting, and again, people do it differently, but I tend to sit here, and to me, if I'm sitting here and I side bend, I'll feel this one come away, right? And then if I come up to the next level, now I'll feel that one lift as I come up. So I'll feel them peel up, and I'll just be able to pick that up here, 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 as I come up the spine. So I'm looking to see how well they side bend. All right? So first I just want to feel if it moves. I'm going to add this little tidbit to it. So let's say I'm coming up and I thought whatever level here didn't quite move. All right, so I'm coming up and it's moving, but is it stiff? I could come off and block it. So I'm coming up here. I didn't feel that one lift as well as I felt that one lift. Let's go back here. I'm going to put a finger and block that one, and then I'm going to bend it up. How stiff does that feel to me? Good. Let's go up and block the next one. Let me do that over there. Yeah, that one moves. This one, a little stiff here. So sometimes that might help you hone in a little bit more by just kind of, because we know that the spine, if I start lifting this up, should curve, right? Exaggerate, right? And if I'm not coming up here, or I seem like I was a little slower coming up there, I could say, oh, let me block this one and really, yeah, oh, that side is not opening up as much down here. Because that's what I'm opening up, right? The bottom side in this case. Now you could argue the top side's got to close, but that's a little harder to detect. So I think you need to do this, check that. Does that open up? So feel it, feel it, feel it. No, that was a little stiff. Let me feel that better. All right. Make sense? So I could do that. Now, some people have bigger, heavier legs than others, and as I get older, there are other ways that you can do things. This is a lot, particularly if they're 250 pounds and 4 foot tall. It's like, oh man, I can't feel anything anyway, plus I'll have to lift it all. So sometimes, sometimes I do this one just because I like it better for me. But I might come in here and say, all right, well, let's just come in and do this. Well, that moves. That one moves. That moves. Let me block that. And I can check it a little better. Okay, I'm convinced. We're going to go up a little higher. So what am I doing now? Kind of grabbing a little bit of this trochanter thing and kind of taking a hip into a side bend this way. All right. If I wanted to check side bending, in this case I'd probably tell you guys to roll it over. But you could check the side bend the other way by doing what? I could come and flip to and go, let me open that up, that segment. So I could take it this way and side bend it that direction. So then I would come down, if I was going to do that, I would go on the underside maybe, so the my fingertips are setting. So I might have started feeling here, and then being ready to move up and block that to feel this open better. In the other case, if I was going to take it and now take it this way and feel this side open, I would have to I would probably be a little bit here and go, I don't know, that one felt a little stiff maybe. Let me block that. Yeah. Okay, well, you can see where I'm aiming, right? Oh, that one moves. Oh, that one really moved in this case. That was not so much. But you can see what I'm doing, right? I'm feeling, coming back to the one I think is a little rough, hold it a little more and just kind of over pressuring. Just like I would take the shoulder and go, that was a little stiff. take out some of the slack, get a little bit better hold. Now feel it again. So that's kind of what I'm trying to do here. So you can work through the pelvis. Now sometimes the pelvises are all different, right? Sometimes this gets enough side bend. Sometimes though you're just jamming and you're not really feeling it very well. Sometimes you have to go to the ischial tube, kind of lift up and take it more of a pure side bend. So sometimes you have to vector this just a little bit different, okay? But basically, if it's side bending, then I can monitor that and see that. Now I like this one because of what? I can then go into treatment. And the reason I'm teaching these joint plays is they're going to turn into modes. So I say, oh, they're a little stiff there. Oh, let's just oscillate that a little bit and calm it down. So I begin to treat. I have to find it, feel it first. Okay? Now, another option that you have, assuming they tolerate extension, in fact, it's not too bad, can you lay on your belly with us? Steal this from you. And she's actually not too swagged out. If they really are arched here and they have a lot of lordosis, you just slip a pillow under there and take that down a little bit. I'm going to slide over here just to see what it does to you. And that should be pretty good waist. Looks pretty good. And the other thing that I'm going to do, because of this one, I'm going to use her leg, is I want her to scoot over toward me. So now, how can I do this one? Again, think about the spine is sitting here. And this time I'm going to move her, the spine. I'm going to be doing this. Right? So I'm going to come here, here, here. And you can see these are opening up, right? I'll block it. If I find one that's loose, that one seems a little stiff. There it goes. There it goes. So I might, sometimes I just throw my thumb off to the side after I monitor this. See that these, because this one should be tilting underneath, right? If I'm sitting on this one, I should feel that go that way as I come over. If it doesn't feel like it's coming over as fast as some of the others did, I'll come in and I can block and hit that segment specifically. Because now I've closed these down and blocking this one. Now you can see I'm opening up right there. Okay? So what do I work through to do that? The leg. And if they've got no tight rectus femoris, I can do that pretty easily just like this. I can come in. That's there. Now the drawback on this technique is if they're really, really super flexible with the hips, you have to travel way too far before you begin to recruit the lumbar spine. Or if they have a tight rectus, you may still be able to do it if they're comfortable with this, and let the leg go straight, hold it against your body, and come in here and yawn with you. If anything feels suspicious, I tend to block that segment and then oscillate a little bit right here. Oscillate a little bit. Again, all at this stage of the game, what you need to do is feel movement. Right. And the decision that I still make clinically, because I don't believe in all the grades, but we're going to learn them, is it stiff or heavy? And the other big clue I get is from my patient. How does that feel to you? And it's kind of tight, but it feels good when you do that. If I oscillate a little bit, try to start to loosen it. If they go, no, you're killing me. All right. You take that one. So it's very, feel what you think you feel, and then see if the patient verifies anything, or if it seems like you just totally have the wrong treat. So that gets side bending, which a lot of times we have an asymmetry in side bending. So if I thought your side bending, let's see, we got to lay it this way. Let's say when she went left, right was this, left was there. What would the clinical response be? Okay, I do that. Well, maybe that is a little stiff. You know what? I think I'll move that. And see. Block it. Take it. Find where it blocks. Move it for a while. And then what do? Just set them up and go side bend to the left again for me. If it moves better, I'm on the right track. That's the piece that people don't do. I do it, and I get up and see if it changed. People do this, they do a zillion other things, and they go, oh man, my next patient's here, let me stand the cold pack on you, and get them up when they're done. So did they improve from the move or not? I don't know. They come back the next time, the best you can do is, how do you feel? Well, you know, it lasted for a couple hours and I feel better. Was that the standing cold? Was that da-da-da-da-da-da? So get up and see. If it's better, by God, I'm going to do more of it until it quits getting better. And then I'll say that's, push that as far as I could. All right. So we got rotation, I think was the only other one left. Well, not the only other one, we got the PAs. But this one, on rotation, I got a couple ways I like to do that. I'll show you. This is the low energy one that most of the time I can get away with. Is, again, if I'm going to rotate a spine, it's going to do, we're going to see it doing this kind of thing, right, as I do that. So we'll be gapping one side, closing the other. So what am I going to do? I'm going to feel again. Please. Block, block, I'll stiff, I'll stiff, I'll stiff. So you've got a couple places you can do that. I could, just not too ticklish, I can come under here and grab there. And I do a lumbrical grip because if I do this stuff, it really sticks. So we do a lumbrical grip. So you slide down, get under the SIS. I block. Start low. I'm lifting here, right? I'm part of my rotation. Do that. And I feel how all that moves. And again, I like this because then if I want to move it, I just block it really good. And I can focus it right where I want.
What did you say you're blocking at?
I want the spinous process. Because if I don't block, I might want to just feel it first, just kind of lay my fingers there and feel what rolls. But at some point I'm going to have to come back, and if I want to check this level, I'm going to have to block this one and just pull up. And what I'm going to do is gap this side. Because if that capsule's tight, pitched down, it won't open up. So I'm going to oscillate it and get it to stretch loose. You know, and then again, if when I watch that curve spin, it may be a couple zones there that don't look like they kind of curve as much. And so I might go up and then say, okay, I loosened that one. Let's go up here. Oh, yeah, that one's a little stiff. I'll come over here, lift, and go to that one. Okay. Again, just kind of giving you why we're doing it, so that the main thing is feel it and get a sense of what you're assessing. Now, the other way that you can do it, and sometimes it works. I'm not as big a fan of this. This is again Paris, but of course, if you ever do Paris' stuff, he's like, do it my way, it's a highway. He's a very friendly guy. He's a bit of psycho, but he's done a lot for the profession. I've just seen him do some crazy things. His favorite is this. You're in this class, you're in a hotel, you're on these tables, and he's like, all right, break up. And he just walks around, and first of all, if you're late, you won't get into class. So people pay $600 for the class, and you don't get into break. They're out there. They're late. You never should be late. Late is unprofessional. I leave 5 hours ahead of time, but I have to pick somebody from the airport. So it's my job to make sure old school, customers. Get up here, got shoes on, he takes them off, he throws them across the room. Which in these big halls could be quite a walk for you. So, Mr. Friendly. Right. So if you do his stuff, you have to do it exactly this way. Of course, that doesn't fit me. If you haven't gathered by now, I kind of go with what works in the flow and what fits me. But I could do this through the legs. And I could block her here, just brought up the movement there, brought up the movement there. I don't know if you guys can see where you're at, but you can. The other thing is use your eyeball too. If I want to get the movement there, look, can you see it? I can see it going into there. If you focus where that's at, you see, a lot of times I can judge that. I can, where are you at? Where are you trying to move? And I can see if you're moving what you think you're moving. So use your eyeballs too. They'll help. Now this is called, which way am I rotating? That's always the big one. Oh my God, you kids. Now, how do we name rotations? When we're talking about L5, we're in L4 levels, we're going to be talking about what L4 does on L5. Right? So this is a 5, and forward. And this would be right rotation of L4 on L5. Works. What happens here, though? It flips, because I'm not moving this, I'm moving the bottom up. So what happens when I take the bottom and move it that way? The rotation follows what they call the rule of the leg. So just wherever my legs are going is where the rotation is going. So if I take the legs this way, I'm imparting right rotation. I mean left rotation.
Wait, what?
So with the legs going this way, this is her left, this is left rotation.
Of L5?
No, it's going to be L4 and L5, but that's what I'm at. So just kind of remember that. You have to get the spine down and play with it and go, oh, wait a minute. Left rotation would be that. And he took the legs and did, oh, well, wait a minute.
Same
that
thing.
separates that way. But I could have got that same displacement by going that way. So if that's too much for you, especially during the event, just go roll the leg. Now, roll the leg could be also applied here, right? Because I'm just lifting at the hips, so just say, oh, okay, if the legs were up, they would also be going that way. All right? So that'll help you figure out how to name it if you need to, for your TI or whoever. All right, so that's two ways to do rotation. And the nice thing about rotation is they're almost all done in prone. There is some others, but we won't go there. Now, this one is where you take the airplane wings, it's like what I call them, and you're going to go over on them, and just like Dana was doing on the one rotation thing, I'm just going to go on those and push them. So now, it's not like I'm working below, I'm right on the transfer process I'm going to be picking on. So if I push on the right wing, I'm going to rotate it left. Right? Does that make sense? Hopefully. So now you can only do a few of them here. You can't get all the way up to the L1 because of the ribs too close. But I like this one a lot of times as a very starting technique because I tend to go in here and I find the rib and I let my hand lay like that below that last floating rib. And I come in and I turn and I get my body set and I'm going to give myself a little more. And I'm just going to go sink, oscillate. Is that stiff or not? Then that's going to get me to 3. I'm going to square up the hand, make it horizontal. I'm going to come in and go down on that one now. So I'm going to sink and oscillate that one.
You have your other hand on the table.
And my other hand on the table. It's not in space. There. All right. So I went 2, 3, 4. I'm going to follow the crest. So now I'm going to pivot this way. Come in on that TP, sink, and oscillate that way. Now I can't get in and push on L5 because the pelvis is in the way of the crest. So now to get that one, I go over and go over to the crest on the other side and check that one. So now I'm getting relative because I'm moving below. Okay? So it's come down. And I like this one because I can turn it into treatment. Oscillate it, oscillate it. It's a nice general technique to loosen people out. Most people don't scream and holler too much with this one if you approach it right. What am I trying to do is trying to get this part of my hand sunk down into something that seems semi-firm. I don't want to put my piezoform on it. I'm going to put my soft cushy part on it. So I'll sink it down, find the ribs, come in, right there. Stiff or not. Here. Sink it. Something firm. Here we are. Tight or not. And I work my way down. You do on the other side of the table and do is repeat the process. Boom. 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 Okay? So those are nice. Because now I know what way I'm rotating because I know what wing I'm pushing. Oh, it's going that way. Push on that way, it's going that way. But again, it's often a nice one to do. Now, the other thing that you can do, especially if you think fairly acute, in the 2-week window there, the FQ is such and such, hip rotation, really symmetrical, greater than 35 on one side, no pain past the knee, really into the leg. Maybe it's a Flynn person. Now I could come down and do this. I could just check the stiffness of the lumbar spine. Come down, put this thin. This time I'm over the spinous process. So I'm going to come in, sink, and check the stiffness there. You okay with all this? I'm assuming your back is normal or semi.
Not really.
Well, why do you volunteer for this brutal
Because it
treatment?
hurts. I want to see if this would help.
And I'm checking another level. You okay with all that?
I'll let you know.
I like those kinds of patients. I don't like the heroes that will let me kill them and then go, oh, it was all terrible. So, well, did you say something? There. Just do. And I'm checking it. Now, for the clinical prediction rule, what they would say is if I found any place that I thought was hypermobile or stiff, that's a go. That's a positive finding. So I fit one of the criteria. It's not down the leg, that fits 2 of the criteria. Right? I just had it less than 2 weeks, I'm at 3 criteria. I probably am bringing them in if there's no contraindications. So, but I like this even regardless if it's one of the rules. Sometimes this is really good for those people who just have a stiff back. The old spine, just a no spine, and maybe they can't arch up, they've got bad shoulders, they're 80 years old. This kind of stuff might begin to make them feel a little better. All right? So that's the joint play, because we cannot do passive range of motion. We'll have to go into segments and see how stiff they feel. All right, any thoughts there? You have 15 minutes to whip that out. Get what you can get. We'll practice some more next time. The other thing I'll probably move to is we'll probably try to get the hip range of motions done, because we'll be moving to the SI next week.